many of you. I'm absolutely made up that we've got so much interest for the service and to see so many of you here today, giving up what might even be a lunch break. So thank you very much for that. As Richard has just said, I'm going to go through a presentation I've prepared today, just to give you an overview of what the service is, what we provide, how it all works. And then there will, of course, be an opportunity at the end to answer some questions as well. So I will just do the doings of sharing my screen. Bear with me. There we are. Okay, so here we are with our wonderful new logo. Really love it as well. So, hi everybody, my name is Debbie, or Debs, as Richard said. I've been with the NHS for about 17 years now. My background is in medical education. I've formerly been the GP Training Scheme Administrator at York and Scarborough Trust. I've worked in workforce development, and I'm currently a senior member in the Your Health team within Humber Trust, and our focus there is on prevention, recovery and wellbeing. I've also worked as a mental health and wellbeing coach and have supported people with low-level mental health needs back into employment. So that's just to give you a little bit of background about where I've come from and where I've popped up from. Okay, so we're going to talk about social prescribing. Some of you may be familiar with the social prescribing model more widely, but in case you aren't aware, if it's a brand new term to you, I will of course be going through that and explaining what it all means. So, Richard alluded to North East North Cumbria ICB is enhancing the support available to the workforce. And with the introduction of this social prescribing offer, it's designed to sit alongside and strengthen the existing staff wellbeing hub. So the exciting addition recognises that recovery is personal, holistic and multidimensional. So we combine occupational and wellbeing support with tailored non-clinical social prescribing to create a more rounded and compassionate pathway for staff who need extra support with their wellbeing and recovery. So what does it look like? It's one-to-one, practical, holistic support, and we help staff rebuild their confidence. It might be to reduce stress in their lives, reconnect with routine, and hopefully to allow them to feel ready to return to work. So the focus is very much on supporting sustainable recovery. That's really key. Helping staff return when they feel well enough, supported enough and confident enough, and with the right help in place to continue to stay well. So almost giving them all those lovely little tools to add to their toolkit, so that as and when things might not be going so well for them again in the future, because we know life doesn't it? They know what to use, what tools to use. They've got it all there to pick and choose which is going to work best for them for any given circumstance. So as I say, we're working in partnership with the Staff Wellbeing Hub and occupational health teams. It's a joined up approach that puts staff at the centre, supporting them to recover well, return well and thrive. Okay, so social prescribing. If you don't already know the term, not everybody does. You might have come across it yourselves actually outside of work through your GP perhaps. It's I think it probably came into existence in the UK now between about 10 and 15 years ago. And the main idea initially was to support our GP practices. The idea being that you may well need to see a GP for something very clinical. But there's also lots of things that affect our health and well-being that can't be fixed through a prescription or a medicine, an operation or even a referral to secondary care. And it's those elements that social prescribing focuses on. So, I guess in the past you might have had people going to see their doctor about perhaps bereavement. And whilst it would be wonderful if we could give somebody a tablet or a medicine to fix that, it's just not possible, is it? However, there's lots of things that already exist within our local communities, teams, services, organisations, groups that already do a fantastic job at supporting people really well through that difficult time in their life. So it makes less sense to take up your GP's time and more sense to maybe go and see your social prescriber, who are often attached to the GP practices and PCNs. And that in a nutshell is what social prescribing does. A lot of the time, it's about signposting. It's about making people aware of all those lovely services that are already existing around them in their community that they might just not know is there because they've never needed them before. And so it's about connecting those people and services together. Primarily, it's about listening, understanding, and signposting. So much of what we do, the feedback that we get, you can't really overestimate the importance of people feeling valued and heard. I mean, if you think when you go to a GP appointment, at best you're likely to get 10 minutes, aren't you? And that's probably got to involve the GP typing up your notes and all the rest of it. At our first and second appointments, we give a full hour, and after that, it's 30 minutes to 45 minutes. And so the value of feeling that you've been given that protected time to just talk about yourself. I mean, how often do we get that? You know, it's really, really important, and people feel very valued and heard for having that opportunity. It's about increasing somebody's confidence and giving them the tools they need to become more independent, more resilient and empowered. Feeling empowered is a really important word in social prescribing. It's about giving people that confidence to feel that they can make decisions confidently, and they've got everything they need to make improvements in their well-being within them already. So we don't fix a problem for them. You know, if we could, you know, if we could find somebody the perfect house to rent, or if we could write off somebody's debt, wouldn't that be wonderful? And we'd probably be very rich if we could. But that's not what we do. Unfortunately, we don't have the power to solve everybody's problems, but we are here to talk them through it, give them advice, point them in the right direction so that they have got everything they need to be able to make things better for themselves. And I guess it's really nice thought to think of us being that constant thread running throughout their wellbeing journey, giving them that positive boost and just somebody that's on their side. And that's really, really powerful. So it's very much a collaborative, co-produced, person-centred approach. The emphasis is working with that individual, and initially there's so much importance on gaining that person's trust, getting them to open up and speak with you, establishing that rapport, and really understanding, again, a very social prescribing term, what matters to them. It might be very easy to make assumptions based on what they've told you or what comes through on a self-referral form, but really opening up that conversation with them and unpicking what's going on for them in their lives, and understanding what is it that's going to make the difference, that's just going to click in that person's life, that's going to open everything up and make things better for them. So very much about motivating that person to often make changes, behaviour change. You know, it's such a simple saying, but I truly believe that nothing changes if nothing changes, you know, and often, you know, it's so true that if you always do what you've always done, you'll always get what you've always got. So something somewhere within what you're currently doing needs to change, maybe not massively, but there's something that needs to change in order for the outcome to change and for you to feel better. So it might be that they're looking to seek fulfillment in their life, a better, healthy work-life balance, and that's fundamental really to achieving their personal well-being, sustainable behaviour change, and ultimately better performance at work. That's what we're looking for, isn't it? So we use that traditional social prescribing model that I described to empower and motivate service users whilst instilling confidence and providing valuable information to often ease anxieties about something. Person-centred, co-produced. A lot of what we do, certainly in the first few appointments with people, is really establishing, okay, so what's going on? What would you like to change throughout the period that we're working together? If you could have a magic wand, I say this all the time, if you could have a magic wand to make things better, what would be that one thing that would change by the time we've been working together for a number of weeks? What would be your goal at the end of all this? And that's a really powerful question to ask people. And then we go through and we talk, so how are we going to achieve that? What could you do to make some changes? And we work week by week with that person, often making very small changes, baby steps, building up the confidence, and then in that way they can find those solutions to everyday challenges and worries, and we talk about the journey of change, see how they move along that journey of change towards wellbeing and recovery. So aims and objectives then. So the intervention aims to reduce economic inactivity and improve workforce wellbeing. And we do that by providing tailored support to NHS staff through wellbeing assessments and co-produced action plans, facilitating access to clinical and non-clinical services depending on what support they need, and integrating with the staff mental health and wellbeing hub and local work-well pathways. The service targets a 1% reduction in sickness absence across the North East North Cumbria ICB and aligns with national NHS priorities, including the NHS long-term workforce plan and planning guidance. And we will monitor that progress through monthly reporting, evaluation, and that's including wellbeing metrics, engagement rates, return to work success. I'll talk a little bit more about how we will be measuring that as we go forward. So what actually is it? So appointments are one-to-one, completely confidential, and they provide a safe space in which to talk. They're delivered online via Teams, just like we're doing now, or by telephone if that's the preference of the person, and that's purely because of the large geographical location that we cover, the geography. We're aiming on weekly appointments to gather that momentum. I think if we possibly can do one appointment a week for people, barring annual leave or holidays and things like that, just to keep up that momentum, to maintain the progress, and ultimately to try and get people back to work as soon as we can. We've said that it'll be a 6 to 16 week support programme. However, I anticipate probably most typically 6 to 8 weeks or 6 to 8 appointments, again, depending on the complexity of the challenges they're facing and their rate of progress. We're very flexible. It's just very individually based. We also do follow-up check-ins post-discharge as well. So a few weeks after we've discharged somebody, we will pop in a call with their consent just to check in how they're doing, see if there's anything else that they need. Okay. So they will be introduced to a dedicated social prescriber at their initial assessment. We then move on to, where appropriate, something called the Wellbeing Star. And that's this model that we use to structure the conversation around what matters to that person, to really give the space to talk about what's going on for them, to unpick what's going on. And, it might be that somebody comes to us with a specific concern. Maybe they are looking to make some friends. They're feeling a bit isolated at the moment, for example. And that's what's on the referral form, that's what we're expecting. But through having a wider conversation with that person and just exploring their life a little bit more, they might not even have realised that actually there's other things that they can be addressing as well, which are affecting the well-being. So it's really important that we open up that conversation, widen it, and really explore everything to make sure we're not missing anything. So often things are connected, aren't they? It might be that they're experiencing financial challenges at the moment. Well, if you can support somebody to feel better in that way, they might also feel more confident. They might feel less stressed. They might, as a result, start doing a bit more exercise. So they might lose some weight as well and become fitter. So it's a knock-on effect. So by really having that big conversation, you can unpick what's going on and make sure you're addressing what really needs to be addressed. We'll then look at goal setting and prioritising and working out what the focus of the intervention is going to be. Where do we want to focus our efforts? And that comes back down to what is it they would like to resolve with this magic wand that we've got? What is it that they would really like to make a difference on? Each week there'll be a little bit of homework, so we'll talk about something in the appointment. We'll explore what we think is going to work for that person. And we'll say, right, so between now and next time we meet, have a little try of this, read through this information, go and make some inquiries yourself about X, Y, and Z, and then let's talk about it next week and see how it went. It will either absolutely be the right thing for you and you'll come back and you'll say, amazing, let's do more of this. Or they'll say, do you know what, that's really not me at all. And I would encourage people to be that honest, because if they're honest, we can try something different that will work. But if they're just sort of, nod along and go, yeah, no, that's fine, it's not really going to be that beneficial. So I really encourage people to be very honest about what's working and what isn't. And then we continue on each week with progress reviews, reflection, and monitoring and checking in with that person. How are they feeling? Are they feeling an improved sense of well-being? Is there something else we need to be looking at? Has anything changed? Anything else come in since we started that's changed their situation that we might also need to add to our list? So sometimes, I mean, I'll be honest with you, this is a brand new service and we don't necessarily have the answers or a crystal ball about what people are going to come to us with. But I can tell you the type of thing that we're expecting and the kind of things that we've already supported people with in the other service that we lead. For example, rebuilding confidence and routine, reducing stress, isolation, overwhelm, anxiety, supporting issues around housing, debt, welfare, finances. Cost of living is really affecting people, isn't it? We know you maybe have some experience of it yourself. It's really hard at the moment and it's really affecting people. Might be connecting people with supportive communities, making friends, being part of something, addressing that work-life balance, doing fun things, getting the most out of your life to make you feel better, and strengthening those coping strategies to support long-term well-being. It will be different for everybody. It's really dependent on their circumstances and the individual person. So it's very much a case-by-case basis. It's about making use of what's on their doorstep already to help their recovery. Could be around physical health. We know getting outside, moving more, feeling part of something. We talk about green and blue social prescribing. It really just means green social prescribing, getting outside, outdoors, in nature. Blue social prescribing is mostly things around water and being outdoors. It could be personal interests, things like sporting clubs, book clubs, learning something new, a language or a skill, arts and culture, art and crafts. Could be connecting with others, making friendships, which sounds a funny thing to say as an adult, but you'd be surprised how many people struggle with that. And again, that practical assistance such as housing, debt, finances, and family support. So this is a really important slide actually, and maybe the one where we've had the most questions come into our team inbox, and largely what prompted us to do this session for you today. It's all around eligibility. Who can I refer to your service? What's appropriate and what do I do? So first of all, they must be employed by one of the 11 trusts across the ICB. We receive referrals from the occupational health and HR teams, okay, and they come into our dedicated team email address, and we all access that every day. So as soon as that comes in, one of the team will respond to it as soon as we possibly can, and offer an appointment to that person. It's aimed largely at people who have been off work on long-term sick, but also for those people who are still in work, but they might be struggling to stay in work and just need the extra bit of support. Also, anybody that might benefit from just having this wider conversation that we talked about, the holistic approach to their well-being. Referrals will be taken on a first come, first served basis. And I've put just under there something which Zoe and Richard and I have discussed, which they may want to at the end just say a little bit more about. But it's basically, we don't know what sort of demand we're going to get for this service just at the moment. So as a little caveat, we will be reviewing capacity over these initial weeks and months to ensure that the resource is available to those in need. And initially, I think it equates to around 3 or 4 referrals per trust in the first few months. If referrals aren't received initially to fill the places, we'll come back to trusts and offer that support to inform them there's capacity. But it's really just to say, bear with us. We don't know if we're going to get 1 referral or 100 referrals. So whilst we're just working that out, we will be as fair as we possibly can. Okay. So the referral pathway, it is to send a completed referral form from an occupational health or HR team to our team email address. And I'll just ask Callie, would you mind just adding our email address to the chat for me, please? Just so that everybody's got it. Thank you. Appointments will be set up very quickly to suit the individual. And also, it's important to say that we welcome email inquiries. If you're just a bit unsure whether social prescribing is an appropriate form of support for your staff member, if you're unsure, very happy just to take a question and just bob us an email, check if it seems appropriate, probably will be, and we'll just come back to you if you're unsure. Okay. So we're a small but perfectly formed team. There's myself and I've got 2 of the members of the team on the call with me today. If you'd like to just give us a wave, guys. So I have Callie and I have Anjali. Kay's unfortunately not with us today, but I'll give you a wave from her. All absolutely friendly, very, very approachable, very experienced, and will lend an absolute supportive, empathetic ear. And yeah, they absolutely love what they do and feel very passionate about this project as well, and just really keen to be able to make a difference to people, and really passionate about really making well, we don't want it just to be a pilot, do we? We'd love this to just be sustainable, and we're very driven to making that happen and doing the very best that we can for everybody. The next bit is a slight bit of left field information, just for context. So I won't dwell on it because it's not specifically around what we're doing here, but I did just think it might be helpful to understand how it's come about, really, that we're sat here on this call with you today, given that I'm sat in the East Riding of Yorkshire and you guys are in the North East and North Cumbria. So we work for Humber Trust, which is Hull and East Riding. And we've been delivering a social prescribing service for, I think, about 10 years in one way or another to local communities. But I also, as many of us do in the NHS, I also wear a different hat and I lead a different social prescribing team, which supports a really niche group of people, actually. We lead a service which supports international medical graduates. So they are doctors who are already qualified, who qualified overseas, and they are coming to Yorkshire and the Humber, North East and North Cumbria, to further their careers by aligning with a specialist training programme. So you might get somebody, for example, who did their doctoring qualification in Nigeria. They might be coming to Newcastle to do a specialty training programme to become a GP or a psychiatrist or a surgeon, for example. And as you can imagine, I don't know about you, but if somebody said to me that I was going to be moving to Nigeria to start a whole new life, I wouldn't have a clue where to start. And so having somebody to sort of hold your hand through that and show you the ropes and explain how things work in your new country would be an absolutely amazing service to have. And that's what we do. We're now in our 5th year of delivering that service, and it just keeps going from strength to strength. And it was on the back of that service that I was introduced to Richard initially, and is how we've ended up being where we are today. So this is just to give some context, really. We may find that some of those people come across to the UK completely on their own, not knowing a single other person, which I can't imagine how terrifying that must be. Or equally, they're coming along with very young families, which is quite a responsibility and daunting as well. They might not know anybody, have very little support. Because of the nature of the visa that they're on, they don't have access to benefits and funding, such as childcare and things like that. They're adapting to a new life in the UK, to the NHS, to a new culture and a way of life. So we're commissioned by NHS England to support with what's called differential attainment, and that's the difference in performance between a UK medical graduate and an international medical graduate. And a lot of that differential attainment comes from the fact that they are dealing with all this other stuff as well as their specialty training. So I've just included a few testimonials. We're obviously very early on in our supporting with the Wellbeing Hub in the North East and North Cumbria, so I don't have any testimonials to give you of live clients as yet, although they will come. So what I've done is I've included a few testimonials of what we've already done. So this person here said, the level of care, empathy and understanding extended to me was unparalleled. It helped me thrive rather than just survive. I'm writing to express my sincere gratitude for the incredible support you have provided me with during my transition to the UK. The guidance from your team was a real lifeline during what could have been a very overwhelming move. Your compassionate guidance, practical signposting to essential resources, and reassuring conversations made a real difference during a challenging time. The support I received was truly invaluable, and I'm incredibly grateful. I suddenly felt hopeful that someone was there to listen. She was empathetic, organised, and truly attentive. She took the time to listen, broke down every issue I was facing, and provided clear signposting to the help that was available. What stood out most was her continued follow-up and care. She supported me through each step until I was able to move, settle, and regain my stability. So obviously those clients are in a very different situation to the ones that we're going to be working with. But you can see that the kind of support they've received is very similar, and a lot of the feedback that we've had is absolutely what we would want to hear from staff members in the North East and North Cumbria as well. So it's very sort of transferable, and I hope that just highlights it a little bit. And that's the end of my slides. It's over to you to ask any questions, which I hope I'm going to be able to answer. Thank you.
Right. Yeah. Thanks so much, Debs. That was really good. Fantastic, really clear. I found it very helpful. So thank you so much.
Great.
If anyone wants to put their hand up, I'll come to you and we'll ask some questions, and please do be interactive. We've got a few questions in the chat, Debs, which I'll put to you if that's okay.
Yeah, thank you.
And then I'll work through those first, and then I'll come to you, Helen, if that's okay. So the first one, I think really important and helpful question is, what is the difference between a health coach and a social prescriber?
I guess it depends on the organisation, because in my experience, depending on which organisation you're in, we're all called different things. And our emphasis is on different areas of well-being. I know certainly within Humber we have mental health and well-being coaches, and they would focus more on things like low mood, anxiety, stress, bereavement, whereas a social prescriber might look at all those things within the community that we've talked about, local services to do with more practical things maybe. But I think it depends on the organisation and what they decide to call the person. The easiest way I can answer that, I guess, from my experience, is just by referring back to that social prescribing model and how we work. And it is very much about listening, being person-centred, connecting with services, and being there to really listen and support that person. We do use some coaching techniques, particularly, you know, to find out what they're wanting to achieve, and when we're looking at goal setting and things like that. I don't know how helpful that is. Sorry.
Well, perhaps Helen will put a hand up or come back if there's more clarification needed.
Thanks. Yeah, that's
Thank
fine.
you. Claire Leeds, Claire has asked, which I think you've already covered. Are we for this accepting referrals for those people who are in work as well as those people who aren't work? And it's a big yes, isn't it? We're accepting referrals from anyone who may benefit from this. Yeah. So that's unless you want to say anything more about that, Debs.
No, I think it's just there will be a lot of people who are on long-term sick who need a lot of support to return to work, and that I would say is our primary target audience, if you want to say that. But also, there's a lot of people that are really facing challenges that are at risk of going off from work. And as I talked about at the beginning, we're all about prevention as well. So if we can avoid that from happening in the first place, let's do it. Yeah.
Fantastic. And Zoe has got a question, which is, are there exercise and groups and fitness classes as part of the social activities?
Oh, yes, definitely. Yeah. It just depends where people's interest lies and what they're wanting to achieve. But if you've got somebody who's, I don't know, maybe you've got somebody who's even already working with the Wellbeing Hub, and that's an important thing to say as well, isn't it? You don't have to have put a referral in to the staff mental health and wellbeing hub in order to receive social prescribing support. You can have standalone social prescribing support, get my words out, or you can do both. I spoke to somebody last week and I've already spotted that she would benefit from some support from your team, Zoe, as well. So we've had that conversation, and if she feels ready, we'll put an internal referral into you guys as well. So it's just whatever is going to work for that person. But if you've got somebody who maybe they're dealing with stress and you know that they're not particularly active, and you know that by being encouraged to do more exercise, that's going to help their mental health and their well-being, that's something that we can support with. We can explore with them what would work for them, where their interest lies, what's going on around their local area, connect them with it, and just give them the confidence to maybe make that first move as well. It's a bit daunting if you're going on your own, or you've not done something before, or maybe you've never exercised before, and we can support with that.
Well, it's interesting because Claire's asked the next question I was going to ask you was Claire's asked that exact question, which is if I have a staff member I think may benefit from mental health support, such
Yeah.
as therapy and social prescribing, would you suggest two separate referrals, or would you refer out to those resources? Now, my take on this, and I'm happy for you to have a different take, Debs. My take on this would be I'd be tempted to refer to one of us, because the most important thing is probably they engage. So,
Mm,
and I'd be tempted to pick whichever they prefer, whichever they're most likely to engage in, but also what you think is the priority. But I've also said that you can't really go wrong, because we will see the person, and if we think actually this person would really benefit from Deb's social prescribing service, we'll talk to Debs. Debs will pick this person up. If Debs sees somebody she's just described that will really benefit from the hub, Debs will just talk to us and we'll pick them up. So we're not running as
mm,
separate services really. We're running very closely together to get
yeah.
people what they want. So I hope that's reassuring. I mean, you could refer to both at the same time, but and that's absolutely fine. But we are working very closely together, so you can kind of you can also trust us that we'll make those right decisions.
Mm.
Did you want to say anything, Debs, about that?
Not other than that, I agree with you. I think, you might get some people who would be less reluctant to engage with a social prescriber because they might have never heard of the word social prescribing before, and that might make them feel that they're not as likely to engage, and they might be more familiar with your service already, Richard. So maybe go through which, like you say, whichever they think they're more likely to engage with. I know your team are all briefed on what we do and almost like tuned in to spotting if you think social prescribing would be beneficial during their conversations. And likewise, we've got the same awareness about your service. So there's lots of cross working and internal referring. So one way or another, we'll get them the support they need.
Thank you. I'm going to pick some hands up and then I'll go back to the teams, if that's all right. So I'm kind of taking the order they've come in. Helen, you've had your hand up for quite a while. Do you want to come in?
Very patient.
Thank you. No, that was really helpful, Deb. Thank you. I just wanted to check, is there any criteria for people who wouldn't be eligible for the service? For example, if we've got staff who are already accessing secondary mental health services or something, would there be anything where we would say, actually, that's not appropriate for you to go down that route?
I would say refer them to us anyway. one of the things that we do in our initial assessment is we will do the general anxiety disorder questions and physical health questions.
Okay.
And that will establish if that person is, say, at too high a risk to be supported by one of our services and will be better supported by a different service, in which case we've identified that and we would signpost on to the most appropriate service to keep them safe and to give them the best support. So we've got those in place right from the first appointment. I don't think there's actually a reason why you couldn't refer them, but through our sort of filtering process at the beginning, I think it would become evident if they're inappropriate for our level of care. Would you say that's accurate, Richard?
Yeah, absolutely. And also remember that we're working closely together. So so the if Debs has got anyone she's worried about, she can talk to us.
Yeah.
In a similar way that we'll be talking to Debs and her team. So we just encourage you to send people through, and we'll get them the best management. For somebody who's absolutely in crisis and high risk, that might be a different service from the both of us, but we can help them engage with it and make sure they're safe.
Lovely. Thank you.
Claire, you've had your hand up for a while. Thank you.
Hi, Deb. Thanks so much for your presentation. Really, really, really helpful.
Oh.
I think a few of us have the same question around the difference between you and the work coaches that are in place in GP practices via DWP. Now, I'm aware, and I've seen the response in the chat. I think Tracy has done that. Thank you. I'm aware that some trusts, including our own, are starting to develop relationships with the PAS service and looking at referral services, referral pathways direct from occupational health into the work coaches. And those work coaches are placed within their local communities, within their GP services in a face-to-face setting. I think I'm sure there's a question at the end of this, but I'm just trying to paint the background. And I guess one of the questions for us is we're faced with ever increasing options in terms of referring staff to different services. And I think on the back of this conversation today, occupational health teams, HR teams really need some clarity around social prescribing, work coaches, DWP, work well. And I'm not actually expecting, Debs, for you to know the answer to that.
I'm relieved.
Richard might have a better view. And from my perspective, you've given me a really comprehensive overview of social prescribing, which is what I would expect to hear of a service that calls themselves social prescribing. The DWP patient advisors are not social prescribers. They're contributing to reducing economic inactivity to get the same outcome, but in a different way with a different professional background.
No, I appreciate that. And having heard what your comments are, I can absolutely appreciate the quandary that you and others might be in. I'm not entirely sure I'm in the best position to answer your question, because I'll be honest with you, I don't know enough about what those other services already provide. I'm very happy to go away and find out and come back to you. But if Richard, Zoe, Jane are able to shed any more light on it than I am, but I do really appreciate that there is ever increasing support available, which is fantastic. But you just need to know that you're pointing people to the right service, and I get that.
Yeah. I'll invite Jane in, and Tracy might want to come in as well. What I'd say partly in answer to your question, Claire, is what one of the reasons that really attracted us to Deb's service is because of their existing experience in working with healthcare staff. So they're already doing this in the North East and North Cumbria with medical graduates, and with really good results. So and when I've talked to the services where they where they're supporting their medical graduates, they've spoke, in fact, they were what pointed me towards Deb's service, because they're having such good positive experience. The other difference is that Deb's service is working very closely with the hub. So when they're coming to Deb's service and to our service, we're in a way working hand in hand with all of our experience of supporting health and social care professionals. But I suppose there will be other advantages locally of people having face-to-face appointments and having local people in their community, and for me, one of the things I like is that if people are given choice and they actually say, that's the one I want the local one, or I want the one that's really experienced in working with health professionals and linked with the hub, and they can make that positive choice, I think they're more likely to engage. And this is a group that we really want to engage and go through these journeys with us. So I'm maybe not giving you the answer, but I'm giving you perhaps some ways that differentiate a little bit between your local health coaches and the way that we're seeing this service work. So,
Yeah,
but I'll bring thanks, Claire. I'll bring Jane in, because Jane will have a really interesting point of view, I'm sure.
Hi everyone, sorry, apologies for not having my camera on. I'm having really bad connection things. I don't know whether it's because it's a Friday or what, but it was going off and on, and then I thought I'd try my camera on and Richard sounded like a robot, so I've turned it back off again. So I'm hoping you can all hear me okay. Yeah, I think it's probably helpful to give you a bit of a background on this, and Tracy's on the call as well, who's really heavily linked in with what we call Pillar 1, which is where sort of the DWP work coaches sit, which is obviously for the sort of the wider population. When we were looking at the Health and Growth Accelerator and thinking about the services that we had, it was very much piloting. Is there something that we haven't got that is through the hub, that where there is a sort of that social prescribing requirement that wasn't covered off in anything else? So when we originally started these conversations, we were looking at the Work Well model, but at that point in time the Work Well model was just starting, and it was they had to have a various number of fit notes to be able to identify from the GP is to be able to access that. That is expanding, granted, so that's moved on, and there is some areas who are doing self-referrals and things, but what we were hoping to do is to pilot it from different angles to say, actually, what is it like if the employer can request that, as well as so that they would access the Work Well coaches through their GP practice through that route as a sort of a, as the patient in the GP practice. What we were saying is, actually, have we got people in our employment across health and care who would help and access, which is why we've started with the trusts, and we're doing the referrals through the occupational health or the HR teams, to be able to kind of almost have a little bit of a sort of a ring around the people who are coming in to understand whether this is helpful or not for you, because that the whole point in this pilot is to say, actually, can we access it from various routes, and is it helpful? I do appreciate what you're saying, Claire, and I think we need to be clear on how we do that. I guess what we were trying to do is cover all angles, is that there is access for people. So if you had people that were who were employed in your organisations who then weren't necessarily eligible or didn't know how to get into that Work Well route through that, and that is, it's still got a bit of a Work Well, so they would work with employers to think about sort of the adjustments and things like that, but it would come in through that route. I guess what we're thinking of this is there a missing part around the social prescribing, which is why we've gone for a more heavier social prescribing model through this pilot, because we think some of the other parts are sort of picked up either through the hub, through some of the digital interventions, or some of the things that people have already got in place through organisations. But hey, we're up for a debate on it. We're up for, what does this look like, what's working, what's not. If you feel like we need some more communication and clearer comms, tell us, and we'll do our very best to kind of work through. What we're trying to do is give trusts and employees and staff members kind of options through, whether that be through themselves, through self-referral, through everywhere. But sometimes that gets a little bit messy, doesn't it? So we do appreciate that, but we are looking for support in how we can ensure that map looks a bit clearer for you, so you understand it. But that is why we've kind of leaned more onto a social prescribing model through this service, if that helps at all.
Thanks, Jane, that is helpful.
Yeah, do you mind if I just say another two, Kenneth? Yeah, it was just to make the offer as well to everybody that if it would be helpful, obviously we're doing this presentation today to give you guys the the information that you need. But if it would be helpful for us to come and do other presentations to your teams so that everybody in your team is aware and more informed, absolutely we can do more sort of individual, locally based service talks as well. So just contact us if that would be something that would be beneficial to your teams, and if you think it would help. Very happy to do that.
Yeah. Thank you. Now, Claire's asked an important question here, which is, I've been involved with a case that was actually referred by their manager at my request. I'm now wondering if it's been processed. How can I find out? It might be best if Claire drops an email and you can just get back to her. Is that right? What do you think?
That'd be fine. Yeah. I mean, I guess we have to be very careful about what information we share. I'm very happy to be able to confirm whether or not we've received a referral from somebody and whether or not we're providing support to that person. Obviously, I wouldn't be able to disclose the nature of how that's going unless, of course, it raises significant risk of harm, and we have obviously a duty of care to then seek the additional support that we would need. But yeah, I can certainly let you know if we've received it and we're acting on it, definitely.
And yeah, thanks, Claire. And I'm sorry if that has slipped through a gap. Yeah, please let us know, and we'll see what's happened. But I think probably first thing is to make sure that we've got that referral and that we're processing it. So thank you.
I'm not aware that we haven't responded to any that we've received.
Helen.
Hi. Thanks very much for the presentation. I'm just wondering, I know when we were saying that we could have 3 or 4 referrals per trust. Because we've not communicated with each other, and you receive sort of the 5th one from our trust, would you go back to us and say, look, you've had your sort of quote, we'll need to see sort of the other 10 foundation trusts before we can see your 5th one?
At the moment, it's not a problem. I'll leave it at that. Just send them through.
Did you want to say anything, Zoe?
We have capacity. Okay, we will not turn people away. It's fine. If it gets to that point where we are really getting down to the nitty gritty, we'll talk to you about it. But at the moment, it's absolutely fine. Just send them through.
Okay. Thank you.
Jane.
Thanks. Yeah, I think I'm just going to say the same thing. I think when we do this, we try and just make it fair across all trusts, which is why we put that little bit of a 3 to 4 on there. But we do know that some trusts have got facilities like this, and so it might not suit everybody. But with it being a pilot, the play is to get the referrals in, get this up to capacity. Let's test the model out. Let's see what's working and what's not. And the only way we can do that is from numbers going through the service. So, you know, if that means some trusts are using it a little bit more, then that's what it is at the moment. But we would like everybody to have equal access to it. What we don't want to sit and have is capacity and not being used.
Yeah, it would be a wonderful position to be in, wouldn't it? Let's be honest. You know, if we're having to say, oh my goodness, we can't cope, there's so much demand and we're seeing so many clients coming through, let's cross that bridge as and when we come to it. Let's just get, as you say, loads of feedback as well from people. That's what we need to test it.
Yeah, we really want to learn from this, don't we? And yeah, absolutely, it's a real opportunity for everyone in this region, I think. Michelle, I haven't picked your question up about South Tyneside and Sunderland engaging with the Workwell coaches locally. Did the answer to Claire cover that, or was there something else you'd want to know?
No, I think it probably does. I put that message in before that answer, so no, thank you.
Okay, I assumed it would, but I just wanted to make sure. Okay, right. Okay. Any more questions? We've got about 4 minutes before your next Teams meeting, probably. So, anything else you want to ask, or anything else? Okay. Oh, thanks, Claire.
I've just got a whole raft of questions, if I'm honest, Deb.
Okay.
Well, I'll just say, Claire, if I can stay on after 2 o'clock, if you can, if you would just like to have a separate chat, we can.
I actually can't, but
Okay.
but thank you for the offer.
You're welcome.
No, I'm just trying to prioritise. Actually, I want to. I think this is really, really positive. I'm really, really pleased that this service is available. Your comment about your involvement with doctors, I think you will see that with other staff. We have cohorts of staff who are new to the country who are very vulnerable, and I think you will get that as well. Clearly, they're not necessarily taking exams and going through specialty training, but I would think you will see that. Just about one of your comments about the priority is those people who are off sick. And you don't have capacity issues at all, which at the minute is great. But I have a little bit of concern about that, because there are lots of people who are at work who might be off sick if the organisation haven't already put in a raft of supportive measures, and that person is actually working in an alternative capacity. So whilst we like to talk about off sick and not off sick, it's never that binary, and it suits data collection, doesn't it, to say whether someone's off sick or not off sick. But we are really trying to avoid people going off sick by putting as much in place as possible. So it was just really, I guess, a word of caution about having that black and white. And I know obviously capacity isn't a problem at the minute, but I just wanted to raise that. I know it's not a question, but thank you for tolerating me.
Not tolerating you at all. I think it's a really good point, and it comes back to prevention, doesn't it? And I know exactly what you're alluding to. We're all being asked to reduce our targets of sickness absences trusts, aren't we, across the board? And I think it's something that many trusts are seeing across the country. But that doesn't account for those people who might go off sick if intervention isn't put in place. So I absolutely see your point. I guess all we can do is, there will be an awful lot of reviewing and monitoring of the service as we go along. And if it's a trend that we're seeing, and if we get to the point where we have reached capacity, I think it's a bigger conversation with Richard and Jane and possibly Tracy as well, to just say, right, so, it's brand new, it's working, but does it need refining a bit? Is there something else we need to put in place to make this work better? And we're very open to that. With it being so very new, we can make it what we want it to be, to work best for those that need us. And I always just think, nothing's set in stone. We're open to working with everybody to get the best out of it. Very quickly, I know it's 2:00. The only thing I will say, Claire, is I'm looking at your email that says County Durham, and that you've referred to somebody who's not off work. That could well be a lady that I'm working with. And if it is, then she also falls into that category of being from overseas. I'll say no more.
but do feel free to check formally, Claire, with an email. Thank you very much. We are going to stop because it's 2:00, and thank you so much for such an engaging presentation, Deb, and thank you everyone for coming. Any questions, do send them in. As James put in the chat, we'll answer them, and we may put them in general comms